Thanks again for joining me. Today we're going to dig a little bit more into fiber. My name's Nicole, certified community health worker, nutrition educator, and I hold a master's of public health with a concentration in nutrition. I had my own health journey working with a nutritionist one on one and was able to really hone into how nutrition can make you even just a tinier bit healthy. And I'll actually share my mom's story at the end of this. She is not around at this moment, but I will tell you a little bit about how nutrition has helped her too. But back to fiber. So, tips for fitting in more fiber. Need ideas for adding more fiber to your meals and snacks? This is coming directly from the Mayo Clinic, and I will share a link in the notes as well. Jumpstart your day by adding fiber for breakfast. Choose a breakfast cereal with 5 grams or more of fiber a serving. Opt for cereals with whole grain, bran, or fiber in the name. Or add a few tablespoons of wheat bran that hasn't been processed to your favorite cereal. Top your cereal with sliced bananas, berries, or other fruit. Switch to whole grains. Each day, make sure that at least half of the grains that you eat are whole grains. Choose breads with at least 2 grams of fiber per serving. On the label, whole wheat flour, or another whole grain such as oats should be in the first line in the ingredient list. So it should be the first thing listed. Try other whole grains too, such as brown rice, wild rice, buckwheat, whole wheat pasta, and quinoa. And let me stress that again. On the nutrition label, whole wheat flour, or another whole grain such as oats, barley, anything like that should be first in the ingredient list, not refined wheat. Or and don't even look on I do a don't even look on the front of the packaging because sometimes it'll say that it's whole wheat or whole grain and it's not. You have to look at that nutrition label. This is something in working with community groups, especially with kids, I try to show them because there's one picture that I do show them and it says whole grain, but when we look at the actual ingredient list, it's not. Whole grain is like the 10th item down. And if you don't know about nutrition labels, the further down something is listed, then the less of that ingredient is actually in that food. So if it is not the first ingredient, then there's not going to be nearly as much whole grain in that particular food. Okay? Bulk up baked goods. Substitute whole grain flour for half or all the white flour when baking. Try adding crushed bran cereal, wheat bran, or uncooked oatmeal to muffins, cakes, and cookies. Beans and members of the bean family, such as peas and lentils, are excellent sources of fiber. Add kidney beans to canned soup or a green salad, or make nachos with black beans, lots of fresh veggies, whole wheat tortilla chips, and salsa. Fruit and vegetables are rich in fiber as well as vitamins and minerals. Try to eat 5 or more servings daily. You can have fresh, frozen, or canned fruits and vegetables. If you eat canned fruits, choose those that are canned in 100% fruit juice instead of syrup. If you eat canned vegetables, make sure they're low in sodium. And a note to both. Um, with the vegetables, especially with beans, just rinse them a couple of times. Even if they're low in sodium, you want to get as much salt off as possible because we don't want you eating healthier and then you're choosing things that maybe are a little higher in sodium and then have high blood pressure. So choose the ones that are low in sodium and make sure you still rinse them after you open the can. And make your snacks count. Whole fruits, raw vegetables, low fat popcorn without salt, and whole grain crackers are all healthy choices. A handful of nuts or dried fruits that don't have added sugar also can be a healthy, high fiber snack. Just be aware that crackers, nuts, and dried fruit are high in calories. High fiber foods are good for your health, but adding too much fiber too quickly can lead to gas, bloating, and cramping. You definitely don't want that. Add fiber to your diet slowly over a few weeks. This lets natural bacteria in your digestive system adjust to the change. Also, drink plenty of water. Fiber works best when it absorbs water. This makes your stool soft, bulky, and easier to pass. Some of the recommendations that the Mayo Clinic has for when not to eat a high fiber diet include after certain surgeries, when symptoms of some conditions flare up, such as Crohn's disease or um, ulcerative colitis, after developing narrowed intestines, during radiation therapy, living with gastroparesis, preparing for a colonoscopy. Those are times when you should not eat a high fiber diet. And remember, check with a healthcare professional, nurse, or dietitian before you make big changes to your diet. This is especially important if you have health conditions or specific symptoms. Healthcare professionals can provide advice tailored to your needs. They also can ensure that any diet changes are safe and right for your situation. So about my mom and her health. So now I will say she is on a couple of medications, but she wasn't responding really well to the medications, and therefore her cholesterol, because that had just kept getting higher and higher, and then blood pressure. And so she just went to the doctor last week, or at this point 2 weeks ago, and both her blood pressure had come down and her cholesterol, her total cholesterol, and all the components in her lipid profile had decreased. And so, what's really great is that she also started eating better. She started eating more fruits and vegetables, minimizing saturated fat, watching how much sugar she's eating. And then she also, her goal is to walk on her treadmill 3 times a week. And if a treadmill is not accessible, you can always walk in place. There are some great YouTube videos. I personally do two every single morning. Well, by two different people every single morning. I'll pick different videos of theirs just to get moving before work. But my mom started doing that. She's up to 3 miles during her 3 times a week walk, and she's in her 70s. And so, making those small changes can really add up. So, I definitely encourage you to keep making changes, talk to your doctor, and I'll see you on the next session.